And I'm kind of fighting off a cold, so please excuse me if my voice gets hoarse during the middle.
Can everyone see it?
Okay, so this is really a review of ADAP, RIFAB, and LIFIA. I know a lot of you are already familiar with it, but we just wanted to let everyone be aware of, what our requirements are, what's expected, what we have to do, what we have to report to for our federal funders. And then if you have any questions, we're here for you to answer anything that you have, any issues or concerns you might have regarding ADAP, RIFAB, or LIFIA. Next slide, Patrick, please. So today our learning objectives are to understand Medicaid, which we are a part under that division, Ryan White and other insurance client identification, to review Rhode Island requirements for enrollment into ADAP, to illustrate and demonstrate ADAP enrollment and processing so that you get a better understanding of what happens when we receive the application, to review RIFAB enrollment and processing, and to provide a LIFIA demonstration, and then we'll be more than happy to answer any questions. Next slide, Patrick. So Medicaid, other insurers, and Ryan White clients. So as case managers, you must have knowledge of the funding source for each client. We recently had a Medicaid audit, and there were some findings, and I'm going to discuss them at the end, but we need to vigorously pursue any other insurance that a client may have. ADAP is the payer of last resort, and we found that as a clients are going to the pharmacy, we are getting billed before they bill the other insurers. So I'll discuss a little bit more of that and explain the findings later on. Knowing your client's funding source allows you to better understand the scope of services and support that you can provide to them. And agencies must be attentive to not bill Ryan White for Medicaid or other insurance. And that's compliance to program standards that could be questioned by us from HRSA, which did happen. And again, I'll give you a little bit more on this later. Next slide, Patrick. So requirements to enroll in ADAP. I know a lot of you know this, but I just wanted to review it. So you must be a Rhode Island resident. You must have a positive diagnosis of HIV or AIDS. We have to have proof of combined family income at or below 500% of the federal poverty level. And I just want to reiterate that we are keeping 500%. A lot of states have already gone back to 400%, but we are keeping it at 500% in Rhode Island still. You must have a completed medical form with the date of diagnosis as well as test results. This is very important. HRSA has required us to report viral load counts on a lot of the reports that we have to provide to them to maintain our funding. I know in the past, people would just make a copy of a medical form that was like a year old. We need current medical forms with enrollment and re-enrollment. And you must provide any other health insurance information. I know a lot of times the case managers are not told that a client has other insurance, but it's very important that we ask and then you provide us with that insurance information so we can put it into LIFIA so that ADAP is the payer or the last resort, that they'll bill the other insurance company first before they bill us. The next slide, Patrick. So The life cycle of an ADAP application or recertification. So once an application is completed, but the case manager, and we receive that at our office either through LIFIA, still through fax, and we still receive some by mail. Then it's reviewed by our staff. We need to make sure that all the required fields are populated. And again, that's name, date of birth. What's really important on this screen that we don't see a lot is email addresses. We would really like if your client has an email address, if you could fill that information in, because we would use that for any surveys or questionnaires that we would like to send out to clients. And that's also another way for us to reach a client if we can't get them through your research, through you contacting them, or for us mailing an application to them, or us trying to give a phone call when it's for certification time. So if you can get an email address from a client, that would be really helpful to our program. We need to make sure that medical information is attached. Again, that is a requirement from her so that we have current medical information on the clients. We need to make sure that the income levels meet program requirements. And if they don't have any income, we need proof of no income documentation. So I know you guys are really good about getting that to us, but it's just another reminder. And we need to make sure that insurance information is filled out if the client has other insurance. If any of the above information is missing, our staff will notify the case managers on what is needed to complete the application. If all the information is complete, the application is usually approved within 48 hours and the client will be able to access medications needed. If a client is accepted into ADAP, they then can apply for RIFAB if needed. And they have to be an ADAP client. In the past, we did find a couple of clients who were disenrolled from ADAP, and we had them on the RIFAB file still. So they need to be active client in ADAP in order to be able to get RIFAB. Next slide, please. Alex is going to review the RIFAB application process.
Hi, good morning, everyone. So similarly to Denise, I'm just going to give a quick review of the RIFAB lifecycle process. So once a RIFAB application is completed by the case manager, sent to our office, and again, that can be sent via LIFIA, which is the preferred method that gives us absolute tracking and lets us know when it was received. It gives us a source file for all of the supported documents. It can be submitted by fax. That really is, a secondary option, given times of COVID, given technical issues or glitches with faxes. It's really not the preferred methodology. And then again, there is the option of utilizing snail mail. And again, I'll echo that's not the preferred methodology in regards to receiving the application. LIFIA gives us the most sound and concrete way for us as staff to be able to track the application and track the data. And then also cuts down on us having to enter it into LIFIA as well, so that case managers and ASOs themselves, when they go on to LIFIA, they want to look up certain information in regards to applications that they've submitted in the past. That information will be at your fingertips as well. So it just serves a dual purpose for everyone just to be doing it electronically. But again, once it's reviewed by EOHHS staff, and then a designated health source Rhode Island liaison. So that's important to remember that it goes through a two-step review. We're reviewing the application to make sure that all required fields are populated, that it's in compliant and receives all the eligibility kind of checkoffs in regards to the ADAP program or the RIFAB program. And for those of you who are not familiar, it's the Rhode Island Federally Assisted Benefits Program. So this is helping with the insurance. Health Source RI also has a mandate as well, where they have to make sure that everything is in compliance with ACA standards, the federal standards. So they're looking for a lot of those boxes, all the boxes, to be checked off as well, so that they can check up against anything that needs to be verified or anything that may disqualify the applicant from being able to take part in the ACA. Okay, so for us, we're checking for ADAP status. As Denise alluded to, that's very important for us. It's a requirement for the program. And another important thing to remember is if someone is ADAP active, they join the RIFAB program, and now they're covered under RIFAB, At any point, if they fail to recertify and now they're no longer ADAP active, RIFAB, and this is not a designation that we've put in or a criteria that we've put in, but federally, we're not allowed to continue covering the benefits for the client for that insurance premium if the ADAP isn't active. So some case managers here may be aware of instances where someone has been terminated from RIFAB coverage, but they still have an insurance plan. We just can't pay for it because they're not eligible anymore due to the ADAP status. So in that instance, the client would be responsible for the premium. So if we're talking about a premium that's $200 a month, over 3 months, they haven't recertified, that's $600 that now the client now has to pay in order to maintain that insurance, um, or try to, seek out EFA in order to reconcile that bill before we can continue covering the insurance plan. So it's really important that we're looking out for ADAP active status, particularly for those clients who are RIFAB active, because it can have financial implications for them that, that it just creates more encumbrance for them and more for the case managers to try to resolve. Um, Insurance coverage has to be verified or outlined in the application. So again, Denise alluded to a coordination of benefits, making sure that ADAP is the payer of last resort, and that's inclusive of the RIFAB plan. If there's another insurance plan that they have active somewhere else, we've seen before where someone isn't aware that their spouse may have a plan that they initiated through their employer, and they're actually covered on that plan, but ADAP is still paying for an insurance plan for them, and that doesn't fall under payer of last resort. That's a duplicative services, where ADAP is paying for something that could be going to another client. So things like that are just very important for us to pay attention to, and for case managers who are filling out applications to look at. Proof of household income, cannot stress this enough. In regards to uploading household income, it's important for us to make sure that this person is eligible, in regards to that 500% of FPL, that Denise mentioned previously. But here in RIFAB, the financial implications are much worse. So just using round numbers, if we look at a family account that may have 2 or 3 people on it, that premium may be $1,000 a month. The client receives a discount based on their income. So if they're receiving, let's say, a 50%, 70% discount, knocking that bill down to, $500, $300 a month from the 1,000, that's fantastic for the client. That's savings for the program. That works great. If the client's income changes in the middle of the year and they continue to receive that discount every month, when they file their taxes, the federal government will take back that discount. So $500 a month discount over whatever months where the income changed, where they were no longer eligible, that'll just get deducted from their tax return if they had one coming. And then whatever the remainder is will just be applied to future tax returns. And I've seen it. It's heartbreaking for clients. I've seen them come in. I was supposed to get $2,000. It was going to help me catch up with all my bills. And instead, I got a bill from the government for $5,000. And what happened was they worked a lot of overtime. They no longer were eligible for that discount. And it would have been fine. They could have stayed on RIFAB because they were still under 500% FPL. We just had to know about that so that we could adjust the numbers so that tax bill wouldn't hit them. Any questions around any of that, please feel free to chime in. I know we'll have some time for questions later on, but just wanted to make sure that I stressed that point. Let's see, proof of Rhode Island residence, uploaded or attached. This is another important point. This helps us to be able to keep up to date with our demographic information, for mailing out information to clients, for making sure that it's going to the appropriate place, and for cross checks for us as we're moving everyone, or we've moved everyone into this new data system, making sure that we're cross checking all of the identifiers for everyone. So having most up to date street address, anything else that can help us identify individuals, name changes, things of that nature. will, keep us from either misidentifying somebody or not having the most up-to-date information in a record. Program required releases, very, very important. This allows us to speak with HealthSource RI in regards to the client's accounts. This allows case managers to call HealthSource RI and speak to our designated liaison, as opposed to just calling a 1-800 number and just fishing around and trying to ask questions, because most reps don't know about ADAP or RIFAB, or that there's a premium assistance. So we have a designated rep that understands this information, has a release based on the one that's signed to be able to assist your specific clients, and can tap into their accounts with you just emailing them directly and not having to go through the whole rigmarole again of, press 9 for an operator and then waiting on the line with elevator music for, 20, 30 minutes. And then additionally, it gives us the ability to have ease of communication in regards to changes that need to happen, to help affect a client's account, to either terminate it when it needs to be terminated, or to initiate it as quickly as possible once you've submitted the application. If the above information is missing, staff will notify the case manager, similarly to the ADAP application process, in regards to completing the application. All clients who apply for RIFAB will have to conduct or take part in a HealthSource RI intake process. It's so, I've had some people who are confused by thinking that once we approve the application, it's all said and done. We've approved paying for the premium. But in order to have the premium initiated and started within a system that we don't control, which is the HealthSource Rhode Island intake and data systems, that intake has to happen in order for that process to be completed. Once the intake is done, and in that intake process, there may be things that are asked of clients that aren't normally asked in regards to ADAP or RIFAB. For ADAP, for ADAP coverages, there are no immigration requirements. That is not the same for ACA. It is open to people of different immigration classifications, but in order to verify that, they will need the documentation. So if someone is a visiting student, they're going to need the visa that designates that they are a visiting student. If someone is a resident alien, they'll need the documentation showing that status in order to be able to approve it. And then things in regards to financials, which we can help supplement that because of the releases, to the liaison as well, to kind of help with that burden of the process. But outside of that, that's really nuts and bolts in regards to the life cycle of the RIFAB process as it's received. Just a couple of things to just keep in mind as we're approaching the dates. So November 1st is open enrollment. That's the first day of open enrollment for every applicant across the country. And then it ends December 31st. Outside of that 2-month window, anyone who's looking to apply would have to apply based on what's called an SEP, special enrollment period. If there was a change in the family size, meaning that there was a decrease in family size, someone had passed away, if there was a birth, if a child was adopted, if the family recently relocated to Rhode Island, not moved from street A to street B, but moved from Massachusetts to Rhode Island or California to Rhode Island, change in employment, anything like that may disrupt their insurance coverage from where they previously were to where they are now. If there's ever a question about that, you can always reach out to us and we can always give clarity. And whenever that occurs, you have 60 days to apply for the new coverage. So someone just moved to Rhode Island, 60 days from when they say that they landed in Rhode Island to be able to claim that special enrollment period. Right, I think that about covers it for me for RIFAB.
Thank you, Alex. So let's talk a little bit about our HRSA findings and review of our program. So I'm specifically going to talk about the ADAP program. We had other findings. They weren't severe. We did fix what we were asked by our federal funders, but I just wanted to explain. So Ryan White enrollee alert. So due to the fact that we noticed many ADAP recipients are not transparent about being enrolled in Medicaid or other insurance. So when that happens, we issue an alert via the eligibility recertification process that essentially warns ADAP enrollees of potential repercussions of holding information back. And we told our federal funders we're going to do the same with case managers, assistant clients in this process. The reason, because that, just to give you a ballpark figure, we had approximately $500,000 worth of claims that were reviewed from the federal auditors. An estimated 380,000 was inappropriately paid by ADAP that should have been paid by Medicaid, should have been billed to Medicaid. So that's people who were enrolled in Medicaid that didn't tell either the case manager or the pharmacist or our program that they had Medicaid, and Medicaid should have been billed instead of our program. And approximately $11,000 was spent on duplicate claims because the clients had other insurance that they didn't tell us about. And again, I'm not saying it's the case manager did anything wrong. I'm not saying the pharmacist did anything. It's the client needs to, if they have other insurance, they really need to let you know, and they need to let the pharmacist know. So at the point of service, ADAP will not get billed. So another thing is immediate termination of all non-Ryan White eligible Medicaid recipients. So because we did have a lot of clients who are on Medicaid that we found out we had to get all of this money back retroactively. So while some client duals are eligible, some people with HIV are not receiving timely benefits of Medicaid, are Ryan White temporary eligible, meaning that we will help pay for their medication until they become a Medicaid client. So that was an issue that we weren't getting notified that the client was accepted to Medicaid, and ADAP was still paying them. So we really needed a way to immediately terminate these clients from ADAP so that when they go to pick up their medication, they wouldn't be billing us, they would be billing Medicaid. So what we did was we worked with our pharmacy benefit managers and Medicaid, and they asked, can we drill down the data runs from our Medicaid down to other insurers on a consistent basis? And yes, so we've begun running weekly dual eligible reports and solo Medicaid recipients, so we can check now that when an ADAP application comes into our office, we have access to be able to go onto their systems to see if the client is already approved for Medicaid. And I'm just going to go right through the next two. So, and we also can see if they have a third-party insurance. So this has been beneficial to us. It's been helpful. We've been able to stop some applications that we wouldn't be responsible to pay for clients. But again, please note, if a client is in the process of getting Medicaid or another insurance, we will be happy to pay for their medication until they are accepted into either Medicaid or the other insurance program. Do you guys have any questions regarding that?
Dee, thank you. Just a clarification too. At your agency level, we've checked in, and you may not be aware of this as staff, but some of your agencies have also been proactive and have developed some preventive mechanisms that we could isolate active Medicaid clients. And as Denise said, it's always been our policy to cover individuals that might need to wait before that actual enrollment process kicks in. We have to be very, very diligent about that, however, because that could be a retroactive payback to the program. And as you know, our program is very small, so the budget isn't gigantic. And while we are in the Medicaid shop, we don't have any magical instruments that will allow us to just see who's enrolled at the time when they're receiving our benefits. So this is a big deal that not only happened at the federal audit level, it happened at the state auditor level as well. So the bottom line is that when we brought this to the attention of supervisors at your agency, some of you were already working on processes, and that's great. You just have to be a little bit familiar with the screening process at your agency. That would be my recommendation, so that all of you have this knowledge, because at the end of the day, because we're all accepting federal money, we have to be incredibly diligent about the responsibilities. And the last thing, I just want to emphasize something Denise said, that we want to do is shackle the patient or the client. We don't want to shackle you, and certainly I don't want to be shackled. So nobody, wants to go anywhere that the feds might take us. But the reality is that we've done our best. I think you can see this, to create a really effective and efficient program, but we still need your help because, as Denise said, when we first saw the $500,000, we're like, and we had to give some of that money back. Thankfully, our Medicaid program paid for that. Thankfully. So it didn't come out of our bottom line. So the good news about us being in Medicaid was that Medicaid acknowledged that we handled Medicaid patients diligently, but we still got slapped on the face from HRSA in relationship to this. So we have a compliance issuance that really resonates with all of you who are funded. So again, just hoping that you understand this, but Denise, you put it beautifully, I think, just in terms of the fact that we definitely need your support.
Yes. And we appreciate it. We know resources are cut, more work has been added to our plates, but we definitely appreciate everything that you do to make sure that the client's getting their medication. And we're really trying our end as well to make sure that we're processing applications and making that the client eligible to pick up that medication as soon as possible. Another thing I do want to mention is that we are going to be speaking or try to speak with the pharmacists on the pharmacy board, or when they have a conference, just so that we can let the pharmacists know as well, to really pursue other insurance if the client has it in their file before they bill ADAP. So it's not, I just wanted to let you know that we're trying to look at every angle in order for us to be able to prevent dual billing, double paying, or having to pay this money back. As you all know, with the state, it takes a long time to get things processed. So this has been like a year-long audit finding and a resolution to, what they found.
Can I ask a clarifying question?
Yeah, sure.
When you say Medicaid recipients, can you be more explicit on what Medicaid products that it refers to? Because from what I see in the LIFIA is that some of our patients are not accepted to ADAP because they're on Medicaid, yet I have other patients in there that are on Medicaid that are accepted. So it's very confusing for us to and it's even more confusing because most of them get the white card and their managed care card. So I want to make sure that we're not inappropriately asking for assistance for patients if they're on a Medicaid product that's their copays, covered.
Okay, so Rob, if the client is straight Medicaid only, if they have Medicaid only, no Medicare Part, Medicare Part, Medicare, the Part D, no other insurance, so if they're Medicaid only, we cannot help pay for anything. If they have dual coverage, which means that you might see it in there as Medicare Part A, B, or Medicare D, then we can assist with co-payments. But if they're Medicaid only, Medicaid, not Medicare, Medicaid only, then they cannot be enrolled into the ADAP program.
Let me just say, Rob, the benefit we're talking about right now is case management, right? So that's why Denise is saying we can't pay if they're Medicaid only. The exceptions are, and this is where it gets a little complicated, is, for an example, Ryan White can wrap around some services that Medicaid can't handle. So let's talk about the guy who has the white Medicaid card. is just solo Medicaid and needs oral health benefits. Your agencies, right, through our oral health benefit, APRI organizes this for us, and you've sent many people that way through all the agencies. We can pay for oral health benefits in Ryan White. But the benefit, just to be clear, that we're talking about here to answer Rob's question, is Medicaid case management and Ryan White case management. So it is kind of complex when you realize that somebody's carrying a white card, but oh, wait a minute, I just gave them emergency relief. So what you all have to really attend to, and perhaps this is something that we could add to the other training, is what are the other benefits that Ryan White wraps around so that somebody with a Medicaid card actually can get those other benefits. And maybe I'm emphasizing something that I shouldn't. The word benefit in Ryan White really isn't applicable because we're not an insurance program, right? We're a grant program that helps, in this case, to wrap around Medicaid only for supportive services that Medicaid doesn't handle or doesn't take care of. So remember, going back to the folks who know this, right? You've been around for a while. You've heard payer of last resort. You know, we should have t-shirts made. Payer of last resort. Medicaid is a payer of last resort, and so is Ryan White. Gets really confusing. But at the end of the day, we're very clear, and so should the agencies, and many of you are, that there are Medicaid benefits, and then there are Ryan White program services and supports that theoretically Ryan White wraps around Medicaid recipients all the time. Case management's different though. Why? There's a funding source for Medicaid for HIV case management, and there's a funding source for Ryan White HIV case management. What was happening is that you had a Medicaid client in the system that was enrolled in Medicaid, but was getting billed to Ryan White. So that was the dilemma that caused us all the havoc. Rob, I hope that makes sense, and I hope that clarifies it.
I'm speaking more to strictly the ADAP. Okay. And I totally appreciate you going through that part of it, the benefits part. I'm good with that because we don't have many patients that are uninsured, fortunately. But when we talk about ADAP specifically, and we look in LIFIA and we say patients not eligible for ADAP because they have Medicaid, they're not eligible for ADAP. Because I'm assuming that Medicaid pays the copay or pays for the medication fully.
Could I ask you a question? I'm sorry, Rob.
Yeah.
If they have oral health benefits, are they considered an ADAP client?
No.
Okay, so
No.
that's separated, right?
This is medications only.
Only.
Right.
The
So this should be
Medicaid
very
pertains
clear
to
then.
medications only.
Yeah,
Right.
so Rob, it should be very clear in the system that there's a distinction between ADAP, and we'll just clarify that by saying drug benefit program versus Medicaid. Because Medicaid recipients get 100% of their drugs covered. That formulary is probably better than ours. Right? So
right, it is.
What's that?
It is. So I did go look at the formularies for the managed care.
Yeah.
But there's different Medicaid products, okay? There's the managed care, like you have the neighborhood integrity, which is the dual eligibles. You have right care. Any patient, any HIV positive patient that has a Medicaid product from either United or neighborhood or straight Medicaid where they only have the white card, if they have any of those products, they should not be applying for ADAP. Is that correct?
If they have,
If drug benefits are taken care of by Medicaid, the answer
Right.
is yes.
yes.
All right. So then my question is this. As I go through our list, some in LIFIA do say, like, client has Medicaid, not eligible. And Shrey puts the note right in there. It's plain
Yeah.
as day.
Yeah.
But then I'll get requests from patients that say, well, my medication's not completely covered and I can't afford the copay. And I wonder, because they have a Medicaid product, they have Neighborhood or United, Right Care, or Integrity. And I wonder, like, if it's on the formulary, why is it not being covered? It's a Medicaid product. So if I'm hearing you correctly, any patient on Medicaid product, MCO or straight Medicaid, should not be applying for ADAP?
So in the share programs, Denise, there and
Yeah.
Rob, the share programs in some cases, like Right Share, allow people to work through either their employer insurance, and ordinarily there's the Katie Beckett population that I'm thinking of that requires an out-of-pocket expense, but it alleviates a great deal of
Yes.
other expenses. So in
Yes.
those cases, it may be a little bit more complicated.
So
And
the share products, the shared cost products, they may be
usually those,
eligible for
yeah.
ADAP.
So when we speak about, oftentimes, and this is where semantics are important, Rob, so thanks for bringing this up. Oftentimes when we think about the Medicaid solos, we're not necessarily considering the share because we know that that's a smaller population. And again, that is something that might require us to look into. So for an example, if it's a person living with HIV, obviously not a family member, because with shares, you have to remember there are some individuals that are family members that are not HIV. But the reality is that we can theoretically take a look at any shares that a person living with HIV has and look at any copays, because that would be like, as Denise mentioned earlier, dually eligibles, right? Medicare, Medicaid people, we will pay for copays and premiums as well, right, Denise?
Yes.
So with that said, that dually eligible population has a Medicaid tag, and initially the auditors were overlooking that. So what Denise did is she said, well, wait a minute. We do have some Medicaid eligible people in the program, but they're duals and we're paying for their copays. And Ryan White allows for that to occur. So Rob, this might be similar if you have cases. What I recommend is that you bring them to, Denise and Alex's attention, and we could work out, some scenarios that might be able to assist with some of those share pays. We don't
Yeah,
know
and
all the situations, so I can't be specific.
And we have, and Rob, we have access to the Medicaid screens. So we might be able to see that they have another type of insurance that you don't know about in there, or they're covered under a different plan that you don't know about. So
Okay,
in those
thank you.
instances, yes, please bring them to us.
All right. Perfect. Thank you for clarifying.
You're welcome. Are there any other questions regarding RIFAB or ADAP? Thank you. Patrick, you can go to the next slide. So Paul is going to give us an update on the TAVI program.
The only thing is I don't see Paul T here.
Oh.
So guess what, Doug? You and I can do that. My recollection was Paul T. Patrick, did you hear from him?
I don't have any emails from him this morning, no.
Okay, so as you know, we're reviving the TAVI Red program, which essentially offers phones to individuals and a fantastic research-based application or platform. What Paul wanted to remind everybody is that there might be some of your clients out there that still do not have phones, and or that might have TAVI phones that have not been functioning because of the upgrade to 5G services. So essentially the phones that, and Doug, you helped me with this, but the phones that they currently have that were not upgraded are not working properly. So therefore, those individuals were not able to participate in the TAVI Red program. So we're in the process. Doug Ducharme as well as Paul Tumanero are both our statewide TAVI coordinators now. And they've been working with their peers throughout the program to ensure that both case managers and our clients receive phones if they require them. And we have a process by which we could do that. We won't get into how that happens, but also to remind you all that these upgrades really do need to happen and we need your cooperation. The next level is to train everybody on the newly improved dashboard so that you can follow your clients in different ways. And we're going to have a very specific training on that later. But we're doing a few things that will allow case managers who are coordinating TAB-E or assisting to coordinate that at agencies. We're looking at stipends right now for those individuals. So we're looking for that level of interest from individuals at agencies that are case managers that are willing to help us coordinate this. But just so you know, I alluded to research-based. We recently had a research evaluation research process done, and we're in the process of actually publishing that. And we found really fantastic results with individuals across all the measures around the HIV continuum of care, as well as other things that are motivating people to actually increase their health and well-being. So we've had a lot of new improvements that since COVID, we got, as all of us did, got hit in the jaw with this. A lot of people became complacent and weren't using the app. But now we're really reviving it and bringing it back because the research was so promising that it's once we get it published, it'll receive a lot of national attention. So I just wanted you all to be aware of that. Doug, did I miss anything?
I think you covered it all, Paul. Yep.
And just a shout out to Doug for all the work he's done. It's been amazing that, we didn't realize we had about 300 and so people that needed to be upgraded to 5G. So you may find people that are saying, this phone doesn't work, blah, blah, blah. You can send them to us, but we also want to make sure that you all have the ability to understand that this has been a really well-researched program and we're showing good results with it. Thanks. Any questions? Back to you, Denise. Your mic, D. Denise, you're on mute.
That's all we have for the Office of HIV and Provisional Care. So if anyone has any questions, now's the time to ask. And if not, then we'll hand it over to our LIFIA presenters. Thank you.
Hello, everybody. My name is Steve Carpelis. I'm here with AJ Boggs. I've also got Karen Thomas here with me. Just a little time check right away. It's 10:48. I know we've been at it here for almost an hour. Our plan is to go over LIFIA and review some of the processes that Alex and Denise mentioned and show how those can be supported using the tool. Would we like a 10-minute break, a 5-minute break just for everybody, or do you want to keep on rolling? I kind of turn that over to Denise and Alex there. And Paul, what would you think? Is a break preferred or not? We can keep going.
I think we should keep going unless anybody, I would never discourage anybody from going to the bathroom or getting a drink on our time. So, but let's keep it rolling only because I think time is so limited and you guys have so many wonderful things to update them on.
You got it. All right. Well, then I'll start off slow here, and then people need to take care of business they can, and then we'll get rolling. So let me share my screen. We've got, hopefully this is coming through for you. Okay. So first of all, thank you for the opportunity to support your programs here. The quick agenda for our portion will be just an intro to AJ Boggs, a LIFIA portal features overview, quick demonstration of some of those features, and then we'll do a Q&A and cover some items if we haven't already. So about us here, allow me to kind of read through this with you. So we're AJ Boggs, an IT firm. We're hired by Rhode Island to build and host out the systems that support ADAP, RIFAB, and other Ryan White Part B programs. We built the LIFIA portal to process client apps for both ADAP, RIFAB, Ryan White, and then we also work with Careware and host it. We have 25 years of experience developing systems supporting grant monitoring of public health programs. We do a lot of work with EHR interfaces, EOHHS, Medicaid, and of course ADAP here that we're talking about. We support 15 different Ryan White programs, multiple state centralized Careware services. We do work with parts A, B, C, and D, prevention, surveillance, and of course ADAP. We also are working with LIFIA to offer an online community for people living with HIV, and we do special projects for HRSA as well. Our client list includes organizations, healthcare, defense, manufacturing, and other federal government agencies, and we do the full project life cycle. Okay, so LIFIA portal. There are many different areas that LIFIA portal can support. We do mostly eligibility determination, client applications. We do have some self-service. We have form building, user admin, reporting, Medicaid, and other source interfaces, and then also case management. So if I'll switch over here, let me know if the screen changes for you. So I am right now here in the client search area of LIFIA. So first of all, I'm assuming that everyone here has got logins and can get into the application. And the first thing I'm assuming you guys do is create the client right away. So if you go to create a new client, we've got plenty in here already, but I will, we're on the QA server, by the way, so there's no PHI on here. All the names are, some of them normal, some of them a little bit silly, but what we've got here is the client input screen. So first we'll go with, let's see. Now here in the group, we've got all of the different agencies that are active, and then case managers that are available in those groups. I assume that you would be selecting the group that you were in, and then also yourself as the case manager. And from there, you can create the client. So once the client is created, clicking onto that card brings you into the client landing page. And this is where we've got the start for actions that we can take to attempt to enroll somebody in programs. So on the left-hand side here, we've got the program information. All of it is blank so far because really all we've done is create a first name, last name, and put that client into the system. So from here, we can edit profile, and editing the profile that you can see is a row of tabs across the top, clicking edit, and this allows you to enter information then for each screen. So as Alex and Denise were mentioning, a lot of the times data is necessary to show eligibility, and so the more that you can collect here, it'll be available for Alex to review and determine who's eligible for these programs. So, you know, editing, you can just add in your middle names. A lot of these fields are required, so once you start editing, you need to include anything that's got an asterisk. So I'll have a sex at birth, program management, can select race, ethnicity. This is all just your basic demographics. One of the items that we talked about earlier was just the need to make sure that Medicaid is something that they don't have so that they can apply for ADAP programs. And even if they do have Medicaid, Paul mentioned the fine lines between being able to apply for something and still be on Medicaid, but still be applicable for Ryan White Part B services. So I guess if we can skip back here to, let's go back to a client. We've got a number of clients here that have been created and are in various states of the application process. So if we look for submitting an application, I think that's on the next page here. Submitting submitting forms. So you'll see that this this demo client here, we have two forms in process, the ADAP and Part B services form, and then also RIFAB. And I believe the indication is ADAP first, and then if eligible for ADAP, RIFAB can be applied for also. So clicking in here, here is the intake form. One of the things that you can do here is as you work through the form, you can check the section when you're finished with it. So say you've got an intake, but you don't get the chance to complete the form, you want to come back to it later. When you do come back, opening up this form will kind of have a visual indicator of what is and isn't completed. So client agreement, demographics. Now, a lot of this is all information that you can enter here on these forms, and if you enter them here and save the form, that information, if there's a field that matches that in the client profile, that data gets written back. So one of the things here then in this form, as we go to apply for eligibility, is the insurance tab. So clicking edit lets you make edits to that field. And in this case, we have student insurance. And if we create add entry, this allows you to enter in that insurance plan name. So as you know, if your client has any other kind of insurance, this is where we'd enter that information in. And then once this form is submitted, Alex will be able to review that information and determine, what other programs are not or are available for your applicant. Talked about 500%. Hold on a second. Thank you, mouse a little dry. So on here, the income tab, Rhode Island is still using 500% of FPL. So in here is where you can create income sections for the people in the household. So you'll determine whether or not your applicant is a single or has other people in the household whose funds would go into the numbers. So in viewing details, you can select employment. You've got a university here, stubs 1 and 2. It'll crunch the numbers for you. This person's only at 70% of FPL, and that would qualify them at least for the income portion. But again, there's all sorts of eligibility requirements that go in. So as Alex had mentioned, one of the best things that you can do for the team there is if you have any of this information, please enter it. It might not all be required, but some of it might be helpful in determining programs. We have a document checklist, proof of residency, client's income. These can be pay stubs, driver's license, other forms of ID cards. And then in this document upload section here, this is where you're able to upload PDF scans of those documents. And then even as you are entering that information here in the forms, that data then gets saved back to the client profile in the uploads tab where you can see documents that have been uploaded. So let's see if we go back here to our client list. Oh, first of all, I can't do that because I'm in edit mode. So I gotta go find where I'm at and cancel out. Okay, so let's see, submitted application. This would be a user in a different state. These two forms have been submitted. We can open up that form and see where it's at. Now, because my role here is an administrator on this demo site, it's kind of like what Alex would see. He would get this application and there would be a take action. And he would say under review, update, and then that would let you know when you next logged into LIFIA to check the status of that form. You could see on the program panel for your client here, are submitted. You can see here that this is the form, and if we click it, and you see the status here now is under review. So it was first in progress earlier yesterday, form was submitted. Now another administrator has come in. So this is kind of like a peek on the backside of what Alex might be looking at when he's reviewing items. So once those applications are submitted, what happens on the backside is then Alex would come in here or other staff who was involved at that time and would review, being able to take action under review, submitted. This is the RIFAB. It's just kind of taking you through the status steps of where these forms go. Looking back on the content from earlier this morning, I just wanted to make sure to review parts of the application that supported the process, mostly data gathering. I could go through each one, but I kind of want to open it up to everybody out there. Are there specific items in working with LIFIA that have been challenging for you? What are those? And if there anything that you have questions on now, and I'll try to walk through those answers.
One thing that's a challenge is there's a button to switch the patient to your agency that doesn't work.
Well, that is definitely a problem. Okay, so let's see a button.
But I'm not sure if we're listed. When I saw your list earlier, I didn't see Thunder Mist listed in there. And when I fill out applications and you go to an application, there's only 2 agencies listed. So I have to use the other category.
Okay, so let's see here. So
That might have to do with permissions too.
yeah, thanks, Karen. Could
Yeah, I was gonna add that. Hi, Rob. This is
Hi.
Ray speaking. Yeah, so what happened is that only the clients that belong to your agencies would appear in your list. So when that happened, for example, if client transfer from one agency to another, to Thunder Mist, let's say, and it was clients that only assigned to EOHHS before, then you have to request permission from us so we can assign that client to you. Then you're able to review who is on your list. So that
Right.
actually set up on purpose, yeah.
Oh, okay. Because it just, I mean, it seems way easier to say assign that patient to me rather than have to send you an email. But if that's the process, no
Right,
problem
it's applying
whatsoever.
confidentiality. We cannot share any information that, kind of like we cannot cross tab that. It's only if client go into 2 agency, let's say like if they go to ACOS and Thunder Mist, then that's the only 2 agencies able to provide that client's profile.
Yeah. Mm-hmm.
Yep.
thank you, Karen. Thank you, Srey. Rob, was there more on that one? Was there anything else that's been frustrating you or that you like or need help walking through?
I mean, it's pretty self-explanatory, going through the application part. When you update, so let's say like last week I updated somebody's CD4 and viral load in the clinical part. And then now I'm doing an application. That should be carried over, right?
What do you mean by carryover? Can you
So
clarify that, please?
So when you go into this screen here
Yep.
and you enter the viral load, so if I'm doing a reapplication for someone, a recertification, and
Yeah.
I happen to know that X client's viral load and CD4 were updated recently, but they're not due, I still go in there and update them under the
Right.
clinical information. So then in 2 weeks, I have to do the recertification, let's say. When we go to do the application, whatever's current in their profile will carry over to
Right.
the application, right?
Yep.
Okay,
So,
all right.
but also to keep in mind that, for example, like right now we still somewhat receive the 2021 medical form, even though it's already 2022. So sometime that could be like the latest medical form that are available. But if it's within the 2022, when you receive that information, you still have to update it, make sure that it's up to date.
Yeah.
If that makes
Oh
sense.
yeah, no, I've been updating CD4s and viral loads as I go along. So if I like I'll do a sweep. I keep a separate spreadsheet. I do a sweep of all of our ADAP recipients, and then I go in, and if they have an updated viral load of CD4 and they're not even due, I still update it.
Okay, perfect.
Yeah.
Right. Well, while I'm still here, so I want to also press a few points how I have been receiving, and actually a lot of case managers still have not kind of like fully, kind of understood the process of like having the application submitted, or when the application is still in progress. I would get emails actually from case managers and wondering why they're not able to submit their application. So I just want to take this opportunity to kind of like making sure that we're all on the same page. And the reason why the application is not be able to submit, it's because there are certain entries that needed to be filled out was not filled out. For example, Stephen, can you help me click on edit profile for me, please? So for example, sex at birth, that's one of the things that require for our federal report. A lot of time if it's not filled out, if it's blank, you will not be able to submit the application. So it's not because of your computers running into any problems or, you know, whatever that is, it's because like certain entry that need to be filled out is not filled out. So another point is when you go to the insurance. Stephen, can you please click on the insurance part for me? So when you scroll down, oh, you have to update that first, yeah. And then if you select one of these, let's say if you hit on Medicare or Medicaid, and then you didn't add, you don't add entry down there and then actually have the detailed informations, the application will, the system will not let you submit the application either. So I would oftentimes would receive notification or applications that's not complete, and case managers be, you know, kind of like thought it was because of their computers or whatever. So sometime I would be just like, okay, let me just go and update it for you and submit it for you. And that is really the main reason why, because certain entries need to be filled out in order for the system to accept the application. So I just wanna stress that.
When you, yeah, when you try to hit submit, it tells you that there's errors.
Right. And then
Yeah,
when you
yeah.
scroll up, it's gonna tell you why, and you just have to you know, to fix it. At the end, if you don't hit ADAP or Part B program, you will not able to submit either. So it's not because of the computers or anything. It's because, you know, it's just need to be filled out for every sections. Certain information we cannot fill it out, you know, for you. So only the case managers that work directly with the clients would able to get those information. So that is why, you know, if it's not clicked or whatever, it would tell you exactly why the application cannot be submitted.
Now, once you approve it, if you can go to the, like the profile real quick, like the main page. So once you approve it, how do these dates get populated in here?
So we have to manually do it. For example, there are certain actually steps for us to review the application. We have to check the client eligibility and everything. If the client's first enrollment just got approved, it will take up to 24 hours for us to actually update the ADAP ID. If they run into any issue, for example, if we receive back the error, like because of their social security number or whatever, it might take a little longer, but average of 24 hours for new applications. You know, the most 48 hours for the application to be reviewed and submitted. The approval date, everything is manually put by the EOHHS staff, because all this application has to be carefully reviewed, and we have to constantly check on their eligibility. Like we have to check on the state system to make sure that the clients reach, you know, all the requirements, especially when it's come to like if they are Medicaid client, because it can change anytime, like, you know. So yeah, and then that's the status right there. It would say, you know, where it is, if the application is under review. When you visit that client's application, you will see exactly where it is. Some case managers have you know, kind of like misunderstood again with the application in progress versus submitted. You know, they thought like, oh, wait a second, I submitted my application a week ago, how come it's still not reviewed? But when you go back to the client's profile, it actually is still in progress. So we never received the notifications, so we're not able to review the application. If the application is status is not under submitted.
Steven, are we able to look at the alert icon right next to your name at the
Yeah,
top?
the
I'm sorry,
green and
which?
red.
Oh, no, sorry. The bell. I just wanted to give them a visual.
Notifications.
Yeah. So this just kind of goes back to what Saray was saying. If someone completes an application and it is still in progress, it doesn't show up in this queue. So me and Saray are going into this queue looking for submitted applications so that we can process them in the order that they were received. An application that stays in progress never goes to queue, so it just stays in limbo. So that's what Saray was kind of speaking about, where someone may have started an application, feel like they've completed it, but didn't pay attention to those cannot submit, or just thought that, I got to the very end of it and I did what I had to do. Now I can just X out of the application or X out of the system. You have to make sure that you get to that submission stage. That way we can go ahead and look at it and figure out what needs to happen.
And when you all change it, it sends us an email, which is helpful. So
Russ, do you have a
then,
question about the ADAP and RIFAB?
yeah, so if it's
buttons?
green, it means good to go, right?
Correct.
All right, that's what I thought.
Yes.
Okay. And then dashboard, when you click that, nothing happens. Is that going to be built out in the future? So sort of like Shrey sends us, this is what's due. Other than that, we don't know what's due unless we go into each individual patient. So is that something that'll be in the future? Like you'll be able to see all your patients on like one screen on the dashboard icon up there? So that we can be proactive and like know. I keep a separate spreadsheet, of course, of all the things that are due. But is that going to be a feature that will be released in the future?
Yes, that's the plan. So the dashboard menu item there is just a placeholder here on QA. But yeah, exactly right. So what it'll indicate is there's dashboards are kind of like live reports that when they load, it's just sort of queuing the database, and then it'll sort, if you're the case manager, any clients that you have, it'll sort those clients for you in an order of recertification, like upcoming recerts, upcoming 6-month, and it'll give you a working list that way.
Oh,
That's the plan.
perfect. Yeah, perfect. I
First of all,
think-
Alex and Trace, thank you so much for jumping in and guiding this this review here. For my own part, I'm been here at AJ Boggs for a year now, and I work mostly with Iowa on their installation here of LIFIA. So my Rhode Island knowledge is pretty thin, and Karen's up to speed on all of that. So thanks for letting me sort of wander through the system here. If there is specific areas that you still want to cover, please, we've got time. So let me know, and I'll click through as needed.
Do we have, I guess this is for the EOHHS staff. So do we have a list that, other than outside of the portal? Because I noticed that since we did LIFIA, some of the documents aren't available on the website that we could give to patients, that, the required list of documents, let's say for income, these are the things that are required. One of these things, residency, for example. Because I tried to, you can't, I can screenshot it from there, but you can't copy and paste out of the portal. I tried
You're
to
looking
click.
for an approved list of documents for each of the
Yeah, so
proof of residence. Okay.
yeah, so when you go to like the, because what's available in the drop down
Right.
is a comprehensive list.
Right.
See that when you click that residence document tab, I'm assuming that's current, right? So like that list, so that I could share that with patients, you can't copy and paste from the portal. I tried to but you can screenshot it. But I didn't want to screenshot from the portal. Because I'm trying to, on our end, get all the documentation up front so that when we meet with patients, it's clear, they understand, because it's not a paper process anymore. So that when we're submitting applications to you, you're going through them, you have everything that you need, there's no question. And that when you have your audit, you're golden. I don't want us creating problems for you.
Right. So
But
so like a paper cheat sheet in regards to the
yeah, with
documents.
just
Yeah.
those 3 things on there. So, because what I'm doing is I'm creating a new process here, because we can ink stamp, the doctor can sign the medical form right in the electronic health record, and then we store all of the ADAP documentation that we send you for each application period, so that if you ever came back to us saying we don't have this, I can send it over to you.
Right.
So I want to make sure that when we educate patients, we can send them like, this is what's required.
Yeah, I can definitely compile something like that and send it over to you so that you have a digital format and something that you can print out.
Yeah, that would be great. That'd
Yeah.
be great.
Absolutely.
Thank you, Alex.
No problem.
And then, that's the other thing. So if you go back to that miscellaneous document, the other thing that's not in here, is medical form. So I put that under miscellaneous documents. Is that correct?
Yes, that's fine.
So just type in medical form.
The med enrollment form?
Yeah,
Yeah.
because there's
Yes.
no drop down. All right, so that's the correct section where that would go. All right. I mean, other than those few things, I mean, it runs pretty smoothly. If you try to hit submit, it tells you that there's an error. You can't go any further. I had to learn the hard way on that. I think Shrey had to teach me that you just don't leave the application sitting there. You have to actually hit submit. So I've got into the habit of doing that. And you really can't move forward if all the asterisk stuff isn't filled out. What about insurance document type? If they don't have insurance, what would you like us to upload?
So if you have a copy of the card, that would be really, really helpful.
Yeah, I do that if they have insurance. I always copy over our current insurance card because it's supposed to scan that at each visit or
Right.
verify it. And if it's the same, then it stays. But if they don't have insurance, we have to upload something here. See how it's required?
Yes. Stephen, can you help me go to the client's profile, please? You go to insurance. And if you click on no insurance,
It won't require.
if it's on the applications, it will show you to put your initial and sign. So it's a case manager's responsibility to kind of like,
Expand.
you know,
Right.
put your initial in that, hey, I checked their insurance and they have no insurance. I can affirm that. Then
Okay.
it doesn't show like this on the client's profile, but if on the actual application, it will ask you to put your initial and date it.
All right. And then we should be noting to you if we're like referring them to social services to apply and
Yeah, that would be
Yeah.
helpful.
Yeah,
Okay.
if there's no insurance, if there's a place in the application where you can kind of expand on what's going on. So if it's like no insurance with the intent to apply for RIFAB, or no insurance, client does not have immigration status that allows them to enroll in any plans at the time. Anything like that that lets us know, okay, so there's no need to check into anything else, or this helps kind of paint the picture as to why
Okay.
this person is 100%.
Got it.
Anything else out there? Any other corners of the system to explore?
Alex, did you want us to review the comment section and the notes section? Would that be helpful?
Sure.
Karen, is this what you're talking about? Right on
Yeah,
landing
so
page? Okay.
just to, yeah, so the comments can be filled out by case managers, but just to note that when you go in to edit that, it's, it's kind of live. It's not gonna, if you already have a note in there and you go back to edit it, if you want to keep the previous note, you just have to make sure not to erase it. And if it's helpful to you to date previous comments, just so you have record of that, that might be helpful.
Yeah,
So those you can edit. The eligibility notes can only be edited by EOHHS staff, but you can click on the icon so you can view when those notes were put in.
I followed Shrey's format on that. She puts the date and her initials, and I do the same thing.
Awesome.
Yeah.
I know, Rob. I was gonna say it's like, oh, Rob and I used to like go through just client's profile, like comment back and forth, like.
Yeah. Well, it's easier. It keeps it all in the same spot, and then
Right,
sometimes
right.
I'm in there and for something else, and then something else pops up. It's just easier to put a note. Now, do you get a notification that a note's there, or you have to actually go look at the
For
profile?
the note, no, I don't get notifications,
All
but if
right.
I know that the clients status is still pending and we going back and forth, it's not completed, I would just keep going back until everything is completed. But that's a
Right.
good point. I'll definitely note that maybe it's needed as well for the notification.
So if it's just like general info that I'm throwing in there so you know something, that's one thing,
Exactly.
but if it's an action, we need to send a message.
Yep.
Yes.
Okay,
If it's urgent or anything,
yeah,
email
if it
will be
needs
the
action,
automatic. Yeah.
okay,
Right.
yeah, all right.
I don't have
Other-
anything else left to review.
Yeah, I was just gonna say, are there any other questions around LIFIA itself, or if not, if you know, with the time that's allotted, there were some really great questions that were brought up around coordination of benefits in regards to utilizing Medicaid, Medicare, RIFAB. If there's any questions around that in conjunction to um, you know, how to coordinate any of those benefits or when to apply, when not to apply, more than happy to answer any of those questions.
Well, if not, I would like to just thank everyone for your time today and participating with us. And, you know, we're always here to help answer any questions or concerns you may have. When you guys give us feedback on the system, it only helps us to make the system better. So we appreciate any feedback that we receive. And I just want to, you know, give a shout out to Saray and Alex. Thank you so much for processing these applications in a timely fashion and making sure that our clients are getting their medication.
Yeah,
Thank
no
you.
complaints about that, I'll tell you that.
Um,
Very good, I appreciate your fast responses, it really helps us out.
I also wanted to acknowledge Saray Chan and all the work that she's done. She'll be resigning, so Saray, I just wanted to, in front of all the people that you've worked with, just say thank you. And you can give them an idea of when you're leaving. We're gonna have a very positive transition and work with all of you so that nothing falls through the cracks. But I just wanted to just give it up to Saray for all the work that she's done to help everyone here.
Thank you, Paul. That's emotional.
Yeah,
But
I
thank
know.
you,
Well,
thank you,
we have
everyone.
her for a couple of weeks, so we're working really diligent with her, but so Saray's moving on to really some exciting projects that she's quite the businesswoman, and so we're so proud of her. Having had her in grad school, I'm beaming and really look forward to seeing what the next chapter of life looks like for you, Saray. So don't want you to cry, but gotcha.
It's been quite some time, actually over 5 years, since I joined at EOHHS. You know, uh, from the beginning, it's always so much um, growth and challenges and funds, and it's almost like I know every single one of you here personally, and working in the community together, starting from small projects to up until now. I really appreciated everybody. Everybody has been so kind and and very helpful even since the beginning. I really appreciate it, and it is a little emotional because it's over 5 years. That's a long time of my life. I was early 20. Now I'm pretty much 30. So, but thank you, everybody. I'm just moving on to a different route, something different from what I've been doing for close to 10 years now. So I'm excited, but it's going to be exciting. Going to do a little traveling and focus on my personal investments and all that. So I'm very excited, and please stay connected. And I hope to see you all again soon, real soon. So thank you.
Thank you, Saray.
And if no one has anything else, I'll conclude our training today. Again, thank you all for taking the time to, log in and listen to our updates and listen to us reviewing the processes. We really appreciate everything that you do out there in the field for our clients. And it's a joint collaboration to make things work, and we do appreciate everything.
They all.
Thank you.
Have a good day.
You too.
Thank you.
Take care, everyone.